Hello, I'm John Holds and welcome to our practice. I wanted to discuss the topic of lesions, mainly skin lesions, which would in other terms be lumps and bumps, things that you could be born with, they could be acquired, they could be benign, they could be malignant. Some of these are actually due to infections or allergic reactions, and some of these are due to sun damage and skin tumors, benign or malignant, that have been acquired over time. We tend to see quite a number of patients with these sort of conditions. Most of those folks are referred to us by their doctor, who wants either an opinion or feels there's a need for treatment of these conditions. The options when I see a patient who has a skin lesion, in some cases I can reassure the patient that this is really of no specific concern, perhaps take a photograph and release them. Or we could take a photograph and see you back in several months and try to determine if there's any change or this has become more worrisome. In other cases, it makes more sense simply to remove the lesion. Sometimes benign lesions can overhang the eyelid margin or otherwise be irritating or extremely unsightly. Or we may need a biopsy to direct further treatment. Most cases where we believe that we're looking at a possible skin cancer, we will want to take a biopsy. The biopsy will help us decide exactly what we're treating. In the case of skin cancer, most cases would be basal cell carcinoma or squamous cell carcinoma. It's rare in the eyelid area that these would metastasize or spread through the bloodstream or lymph system elsewhere, but they can invade locally, and therefore they require complete treatment. We occasionally see melanoma, although melanoma is much more rare in this area. In the case of skin cancer, if we have a positive biopsy, often we will coordinate treatment with a dermatologist who does a special technique called Mohs surgery. There are really two important steps if we find a skin cancer in the eyelid. Step one is to ensure we have complete excision of the skin cancer. Step two is to reconstruct the area in the most cosmetically acceptable and normal appearing fashion, and also make the eyelid or area around the eye completely functional so that the eye is protected and has no further problems. In some cases, skin cancer can extend in the inner corner of the eye into the tear duct, and that again requires special reconstructive techniques. Other options for treatment include a simple excision, which we rarely perform in the case of skin cancer, or an excision with what's called a frozen section margin. And in some specific cases, we may be willing to offer these options, although most frequently the Mohs excision technique, which requires coordination with another dermatologic surgeon to carry out, is going to be the plan. And if for any reason we feel that your problem is better handled in someone else's hands, we would be referring you to that individual. Despite all this discussion of skin cancer, I don't want to make anyone too alarmed, as I haven't seen you yet. We may very well be talking about something that's benign or really of very minimal concern. So I look forward to seeing you and we will discuss this.